Most Canadians want to age in place in the homes they know and the communities they love. But how do we make that possible? On today's Carpe Diem, Home, Health, and Hope, Aging in Place in Canada. Staying in your home as you age isn't just about comfort, it's about dignity, safety, and independence. Today we'll meet the people helping Canadians age in place with confidence and compassion. Most Canadians say they want to age in place, and it's easy to see why. Staying in your own home means staying close to the people, routines, and neighborhoods that bring comfort and joy. I sat down with Niary Toodakian from HomeEquity Bank to discuss why this choice matters now more than ever.
Over the last couple of decades, every time we do research to understand Canadians, we hear the same thing. 9 out of 10 Canadians want to age in place.
I knew it was high, I didn't know it was that high. That's a big number.
Yeah, and the connection to the home, I think, is kind of evergreen. You know, no matter what your age is, you've built all these years paying down your mortgage and, you know, building this home, and it just feels a little counterintuitive to have to move away or downsize right when it's time to enjoy it fully.
We know that there's like an emotional and wanting to stay at home, but is there like actual benefits to staying in your own house?
Absolutely. I mean, the lifestyle and emotional benefits of staying in the home can range from just thriving in the familiar and in a routine. You know, you're more likely to combat loneliness or isolation if you're in an area where you've got family, friends, neighbors. I mean, we can't underestimate just being in the proximity of all of the facilities that you may use, whether it's your doctor's offices, your faith-based community centers. All of that resourcing is usually connected to the neighborhood and the home that you've built.
And gosh, you know, as you age, there's so many changes in the world, in your family status. Kids move away, you lose family members, your spouse might pass. That maybe having some kind of familiarity and something that you can control, which is your environment, maybe that's another benefit.
I mean, the connection to the home, we know, is tied very much to mental and physical health, because when you do know the home, the space, the familiarity around it, it can make all the difference in how you spend your days. Yeah. I've got a neighbor who's 94 who lives in a 5-bedroom home, and I always say, is this too much home for you? And she says, no, it's my home. It's exactly the right kind of home for me. We keep talking about aging in place and the connection to the home. You can't underestimate the value of, you know, faith-based community centers, you know, facilities, parks, neighbors. They bring so much richness to somebody's life and retirement, and so thinking about retirement needs to take into account all these factors. It's both emotional and physical.
Yeah, my father's not moving.
Yeah.
He refuses to move.
I think I feel the same way.
Yeah.
I mean, we bought our home now 14 years ago, and I think on one of the concrete slabs we put our children's handprint on it. And the idea of moving out of this house is not even part of my thought process. Like, I plan on aging there. I'm planning on looking at those little hands and hopefully having some grandkids add to those hands. But the connection to the home, I think, is evergreen.
Aging in place comes with challenges: access to care, affordability, and adapting the home to meet changing needs. I continued my conversation with Niary to better understand the real barriers and the creative solutions helping people overcome them.
When we look at our clients, our customers, and why they're accessing home equity, retrofitting the home is definitely top of the list. You know, Canadians are looking at making the necessary changes to help make mobility and comfort in the home kind of a priority, whether it's lifts on stairs or changing bathtubs to stand-up showers with handles. You know, all of these small changes can make a huge difference in aging in place, but they come at a cost. And so accessing the equity in your home to help combat or pay for those costs is growing.
So, my father, as an example, had a health scare. And for the first time, I felt like I couldn't leave him. So my life was on hold while I had to take care of him, and willingly and gladly. But I soon realized that I was not the best person to do that job. I'm his eldest daughter, and that's just too close.
Right.
So I have someone there 7 days a week, 8 hours a day. Medications, cooking, companionship, taking him here and taking him there. And it has freed me up to live my life the way that I've designed it to do. If it wasn't for Judith in my house, I would have to be there.
Right.
And I really quickly realized I'm not qualified. And as a child of the person in need, I don't think that would have worked in my family at all.
Right.
Now, you have a lot more experience in the bigger world of the situations of PSWs and children and parents. Is my story typical?
Absolutely. When our customers come to us to ask about accessing the equity in their home when related to in-home care or PSW, the children are often involved. And there's a couple of reasons for this. Removing somebody from the familiar is probably one of the worst things you can do if there's a health scare or there's a drastic change in their cognitive or physical abilities. And so if someone were to stay in the home during those times and receive that in-home care, the science time and again shows that that is the best approach. And so we help close that gap. It can be very expensive having a PSW come to the home. And so we see families come to us accessing, just recently we had somebody fund a reverse mortgage to help pay for the crucial need that the customer had for that in-home care. So crucial, in fact, is that they were, desperately looking to see if they should be selling the home because they needed to access the funds to help pay for it. And thanks to CHIP, not only are they staying in the home, but they have the funds they need to receive that additional care that was identified by medical professionals for that customer.
For those wishing to age at home, there are many tools and resources that can be accessed through your local health authority. Here in BC, Dr. Grace Park has dedicated her professional life to reducing and managing frailty as we age. And she's an expert in how private, public, and community pillars support healthy aging at home. I traveled to Crescent Beach to meet with her.
So CARES was a research project that we started many years ago in Fraser Health. And I had a conversation with the CEO at the time, and he was saying, there are so many older adults that land up in our hospital, our emergency department. Is there anything we can do to actually improve the health of our older adults as they get older? So we started looking at frailty and prevention of frailties. I think it's really important for older adults as they're getting older to know that you don't have to become frail as you get older. And some of our research was really looking at ways you can prevent frailty or delay frailty. Between 50 and 60 is when you can actually really do a lot of preventative care for yourself. And at that time, you're still really active and probably healthy enough to be able to do the exercises and pay attention to your diet. And we know that by doing that, you can actually prolong your health span. You can delay things like dementia, Parkinson's disease, heart disease, diabetes. All those things can be delayed by paying attention to preventative measures. And when you know that, and as you're getting older, you're starting to really take that seriously.
A big part of being able to age at home is help. Personal help, people help, right? Personal service workers, right? PSWs. So can you expand on that?
Aging takes a while. When we start thinking about aging now at age 50, people live up to 100, that's 50 years. You're going to go through different stages and different ways of getting help and needing help. So those that are nearing the end of life, and a lot of them are very frail, the health system kicks in. But at the other end of the spectrum, we may have people that are starting to get older, maybe having a few illnesses, but they're managing okay and they want to remain independent, but they might need help with things like snow shoveling. We get a lot of snow in Canada. Things that the government really can't fund, and so we don't have that available from our public system. But we do have community resources, and in BC it's funded through United Way. And so we'll have people like friendly visitors that come in and ensure that people aren't isolated and not in touch with the rest of the world. People will deliver groceries, drive them to doctor's appointments.
And these are all temporary visits, right? People come and they leave, come and they leave. So if you want someone to be with you, or you want your family member to be accompanied, not for short visits, but for longer, for that is the private.
So if you want to have a care person, you can hire a person that could live in, and that's a really great way of getting a continuity of care and developing a relationship with somebody. Or you can get somebody that comes in and they're with you for a longer period of time, and that's in the private system as well. So yeah, the continuity can be broken, and certainly the private system can help with that.
Behind every successful aging in place story is a caregiver, often a personal support worker offering hands-on help and heartfelt connection. I asked Niary about HomeEquity Bank's national contest celebrating PSWs and why she feels their role is so important. Now, you care so much about PSWs. You have a whole program to recognize and reward individuals across the country. Tell me more about your home care heroes.
Yeah, so in 2022, we started thinking about who these people are and where Canadians have access to them. And the more research we did, and the more stories we heard about the in-home care professionals, or PSWs, we realized that they are an underappreciated, understated, essential service in Canada. And so we came up with the HomeEquity Bank Home Care Heroes program to recognize. So we request submissions from Canadians everywhere, including Carpe members, our customers, and the public. And they submit stories of in-home care professionals, family members, PSW workers. And as we received these stories, we started growing the number of awards we gave out. In fact, this year we gave out 6 awards recognizing Canadians who helped other Canadians through in-home care, through PSW, with $2,000 cash prize.
And there are thousands of these stories. I know you've known them, but I think a lot of people maybe don't understand the real commitment, dedication, heartfelt love that a PSW creates for their patient or client. I think they become palsy, they become family.
Yeah, you don't realize how desperately you would want an incredible PSW until you need one. And I think that's what we're in the business of doing right now, is really just building awareness of all the incredible people who have chosen it as a career. I always say it's like a calling. It takes a very special kind of person to come into somebody's home and with gentleness and with space to listen and care, almost be an extension of their family. And so the more we can do to build awareness, to educate Canadians, I think the better.
So why do we know that PSWs are essential to be at home with you?
You know, we at HomeEquity Bank, we think about this notion of the caregiving crunch. You know, when you think about the gap in the healthcare system and really the needs of Canadians as they age in place, it became very clear to us that in-home care and PSW work is only going to grow in necessity. You know, our demographic is the fastest growing in Canada. It's one of the largest. And so PSWs and in-home care, access to them, affordability of them is going to be a growing trend in Canada.
What about technology with all the newfangled gadgets out there? What's the latest for aging in place?
You know, when you think about the retirement landscape, I mean, beyond just the economic changes and Canadians living longer and more active lifestyles, technology has really changed how someone can age in place. I mean, the reality is this kind of technology can make all the difference with mobility, with remembering tasks, with setting alarms and reminders. There are so many gadgets to help people age in place comfortably with security. MediCalert is a partner of ours that really helps facilitate that for families to ensure that there is access to technology to help identify or notify in the time of need. So the technology, landscape, I believe, will continue evolving, and all of that will be to help people age in place more comfortably.
Technology can make a huge difference on how we age at home. Household names like Medical Alert are embracing it to give clients and their caregivers better peace of mind.
My father lived with dementia, and for many times he would go missing. My dad wore a Medical Alert bracelet to make sure that he could be identified when he was out missing. One time, someone actually found him lost, and by checking on his wrist for the Medical Alert bracelet, that person realized that my dad had dementia. That person actually was able to call 911 sooner to realize that my dad needed some help at that time.
Medical Alert is a national charity. We've been around for 65 years, and essentially what we do is we bridge the gap between individuals and first responders. First and foremost, what most people would recognize is something like what I'm wearing here, a necklace or a bracelet that actually has information that first responders can utilize right on scene. But over time, as technology has evolved, one of the things that has evolved along with it is the growth of our very large database of information. So one of our most recent projects, as an example, is a direct connection to the 911 system. So our information is translated immediately, in less than a second, to first responders on the front line when they're dealing with an emergency response. So before they even get dispatched, they know what they're heading to.
A person caring for their family member, like myself, who's a caregiver, goes through many emotions such as fear and worry every day that my dad may not make it home safely. That's something that we need to support through different solutions, such as a Medical Alert bracelet, possibly something that's high-tech technology like cameras and sensors maybe in the home.
Medical Alert's dementia program is called Safe and Found, and what we have been doing is really taking a look at how we can do wraparound supports for people living with dementia, but more importantly, caregivers. So it allows families who may be caregiving from a distance to feel more comfort, more ease, more sense of security, that there's a safety net that exists around their loved one.
Aging in place starts with a plan, and sometimes the key to that plan is already under your roof. Niary and I wrapped up our conversation with a look at how reverse mortgages work and how they can fund in-home care, renovations, or new technology.
So HomeEquity Bank has been around since 1986, nearly 40 years. Our flagship product is the CHIP reverse mortgage. Many Canadians made a pretty financially savvy decision to purchase the home when they did. And so their home can now be viewed as part of their retirement savings plan. And we are just one of the vehicles available to Canadians to access cash, a tax-efficient form of cash, in retirement to help supplement their income.
So how does it work?
Really, what a reverse mortgage is access to equity in your home, savings in your home, up to 55%. So depending on your age, the type of home you have, and the location of your home. And accessing that equity, you don't have to make any mortgage payments actually until you choose to move or sell, or the last of the borrowers pass away.
And for some people, this would be a very good deal because house prices have skyrocketed. The value of a house that you bought when you were young, and now you're talking all these many decades later, you've got hefty equity.
Yeah. Well, the second page in our reverse mortgage guide is congratulations. I mean, if you've made the savvy decision to invest in a home and purchase real estate in Canada, you made a smart choice.
Let me ask you this. It sounds like a fabulous idea and a great program. What are some of the concerns that you have to deal with? What seems to be some of the pushback maybe that you get on this program?
A big misconception is that you lose ownership of the home. And so that is one of the first kind of questions that comes our way. And you always maintain title and ownership of the home. I think where we are today is when we think about retirement planning, I think we need to shift our perceptions on what the options are. You know, drawing down on investments can have tax implications. And depending on the investment environment, it might not be the best time to draw down on certain investments. When you think about savings, do people have enough? There is very much a gap in how much people have saved and how much they need in order to age in place. And so our solution is just one option that Canadians should give themselves permission to consider. And what Canadians will find is, depending on what their needs are and where the gaps are in their finances, chip reverse mortgage may be the right solution for them.
I'm so grateful to you for taking time out. I was so looking forward to having you to myself and getting the information that I've been reading about, hearing about for years. And I really didn't know how it worked. Well, I think your heart's in the right place with your Home Heroes Awards. I'm very impressed by that.
Yeah, it's one of our favorite campaigns. I mean, just being able to shine a light on this undervalued, understated kind of service in Canada is such a privilege. And every year the nominations get more and more emotional and more empowering. And we're so grateful for the opportunity to tell more Canadians about it.
Whether it's tech, healthcare, caregivers, or financing, aging in place is possible with the right plan. Today's show reminded me that growing older doesn't mean giving up independence. It means we have to plan to protect it. And that's the show. Remember, as our Carpe chairman, Moses Neimer, always says, the best way to keep going is to keep going. So Carpe Diem and seize your day.